So I come and perform hand hygiene. Hello, my name is Adriana. I'm going to be your nurse for today. I'm going to be performing a head-to-toe assessment on you. Would you mind stating your name and birthday?
Shareef, 5/25/74.
Okay. Would you mind stating the date today?
December 13th.
Okay. And who's the President of the United States?
Donald Trump.
Okay. And why are you here today?
I'm here for physical.
Okay. So the patient is oriented ×4, speech is clear and coherent, and the patient is a well-nourished, well-developed 46-year-old female. So now what I'm going to be doing is testing the muscle strength. So I'm going to have you push against my hand on both sides of the head. Okay. Push against my hand on the cheeks. Would you mind shrugging your shoulders for me? Thank you. Would you mind holding your hands out? Okay, would you push against my hands on both sides? Okay, would you mind grasping my fingers? Okay. And then would you mind pushing against my hands? Push against. Okay. And then we're gonna do the gas pedal reflex or the muscle strength. So you're gonna push down. It's good. Okay, so on the scale, 1 out of 5, the patient's at a 3 with the muscle strength. So the next thing I'm going to be doing is testing the sensation of the patient. So what I'm going to have you do is close your eyes, and you're going to tell me if you feel a sharp sensation or a soft.
Sharp.
Okay. Soft. Okay.
Sharp. Soft. Soft. Sharp. 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 Soft.
Okay. So the patient's sensation is symmetrical and they are intact on both sides. So now what I'm going to be doing is testing your reflexes. So I'm going to start off with the biceps reflex. Okay. Okay, and then we'll do triceps reflex. Okay, we'll do it on the other arm. Okay. So we'll do the triceps. Do the radial reflex. Okay. And then I'm going to hit below the knee. Both sides. And then I'm going to test the feet. Okay, and then I'm going to do the Bushinski reflex. Okay, and all of the reflexes are intact. So the next thing I'm going to be doing is testing for the station and gaits. Would you mind standing up for me? Okay, would you mind taking a few steps forward? Okay, and then would you mind walking on your tippy toes backwards to the chair? Okay, and then would you mind walking on your heels? Okay. And then turning around and walking heel to toe. Okay, and you may take a seat. Okay, so the patient's station is normal and the gait is a normal tandem gait. So now what I'm going to be doing is I'm going to be looking at your pupils. Okay, so then just mind keeping your head still and look straight forward. Okay, I'm going to place my hand right here. Okay, and would you mind following the pen light for me? With your eyes only, good. Okay. Okay, so Perla is intact for this patient and pupils are reactive to light and within pupils are equal size. So now what I'm going to be doing is inspecting the nose. the nose, there's no signs of nasal flaring. And then with the mouth, there isn't any circumoral cyanosis around the mouth. Would you mind opening your mouth for me? Okay. And then the mucous membranes are pink and moist. There's with no signs of cyanosis, and there's no pursed-lipped breathing present. So now what I'm going to be doing is checking the neck. Okay. On both sides, and there's no use of the accessory muscles for breathing, and there's no jugular vein distension on both sides of the neck. So now what I'm going to be doing is palpating each carotid artery on both sides. Okay. And so I did not feel any thrills. So now what I'm going to be doing is listening to the carotid artery with the bell of my stethoscope. I'm going to ask you to hold your breath. Okay, breathe. I'm going to check the other carotid artery. Would you mind holding your breath? Okay. So, after auscultating the carotid arteries, there weren't any carotid roots. So now what I'm going to be doing is inspecting the chest. It's normal contour and shape. And I'm going to be evaluating the patient's breathing. There's no signs of a barrel chest, scoliosis, or any other abnormalities. There's no shortness of breath or intercostal retraction. So now what I'm going to be doing is palpate the 4 positions of the chest wall. And then I'm going to palpate the posterior chest wall. Okay. Oops. Okay. And so I did not feel any abnormalities with the palpation. So now I'm going to be auscultating the anterior and posterior lungs. Take a deep breath for me. Okay. Take a deep breath for me. Side. Okay. Now I'm going to listen to the posterior lungs. Okay, and so now I'm going to be listening to the lateral side of the lungs. I'm going to take a deep breath for me. Okay. Okay, I'm going to do the other side. Take another deep breath. Okay. So the lungs are clear bilaterally ANP. There weren't any wheezes, bronchi, or crackles in the lungs. So now what I'm going to be doing is inspecting the chest wall. There's no heaves that are present. I'm going to be palpating the chest wall. So we have the aortic valve, then the tricuspid valve, and then we have the mitral valve under here. Okay. And then, so now what we're going to be doing is auscultating the valves. There were no thrills over the cardiac valvular areas. Okay. Listen. Okay. So while auscultating, there was normal S1 and S2 heart sounds. The rate and rhythm were normal, and there were no murmurs, gallops, or rubs on S3 and S4. So now what I would be doing is inspecting for capillary refill. So I'm going to be pinching the fingers. Okay. And for the capillary refill, it was this normal capillary refill lasting less than 2 seconds, which is in the normal range. So now I'm going to be checking and palpating for edema. Okay, so I'm just going to press slightly on your arms, lower arms, and then we're going to check the lower extremities. Okay. There were no signs of edema on the upper and lower extremities. So now what I'm going to be doing is palpating for the pulses. So I'm going to start off with the brachioradialis pulse. Okay, and then we're going to go to the radial pulse. Do it on both sides. Okay, and then the radial pulse. And then for the femoral pulse, it would be located over here. So now what we're going to do is do the popliteal pulse on both legs. And then we're going to do the posterior tibial pulse. Okay. And then we're going to do the dorsalis pedis pulse on both feet. Okay. And there are all of the pulses, the brachial, radial, femoral, the posterior tibial, and the dorsalis pedis pulse were all palpated and symmetrical, and it was a 3+ on all of them. Okay, so now what I'm going to be doing is palpating for the temperature of the skin on the upper and lower extremities. Okay, the patient's skin is warm to touch. So now what I'm going to be doing is inspecting the abdomen. Just lift this up. Okay, the abdomen is concave. There are no signs of scars or lesions, and there's no heaves or vibrations or excessive abdominal, bowel movements, and there weren't any prominent venous patterns or engorgement of veins around the umbilicus. So now what I'm going to be doing is auscultating the abdomen in 4 quadrants. Okay. And then for the auscultation auscultation, there were normal active bowel sounds. So now I'm going to be auscultating the aortic, the iliac, and the renal arteries. Okay, so the aortic arteries and the renal. And then the iliac arteries. Okay. And I did not hear any bruits or abnormal blood turbulence or venous hums over the abdominal aorta, renal, or iliac arteries. So now what I'm going to be doing is palpating the 4 quadrants of the abdomen lightly. Okay, and then I did not palpate any areas, any masses, or there were any tenderness of the abdomen. So while palpating, so now I'm going to be doing percussion of the abdomen in the 4 quadrants. I'm just going to lightly tap. Okay, and I noted normal bowel intonation when I perform percussion of the abdomen. So that concludes the head to toe assessment. Do you have any questions?
No.
Okay, and thank you for watching.